Republican Congresswoman Marjorie Taylor Greene has sharply criticized Republicans, saying that there is no health care plan. She says that it's time to get one. Do you acknowledge that President Trump does not have a comprehensive health care plan with which to replace Obamacare?
I fully believe the president has a plan. We've been talking about it quite a bit. There's all kinds of ideas. Yes, the issue, Kristen, is which specific parts of the plan do you prioritize? Which are the ones you want to focus on? What was done with the One Big Beautiful Bill was perhaps the most ambitious reform of our Medicaid system ever. It was a massive effort to realign the president and the leaders of states, governors, so that what the federal government wants to do and what the state government wants to do for our most vulnerable citizens are done in coordination. The president did that with a great passion. He led the way. I spoke to him frequently during that process. We also took out a lot of the fraud and waste and abuse, so it was hurting the system. Kristen, we would have spent $5.4 trillion more on Medicaid if we hadn't addressed that. That would have basically made us a big healthcare system with a small country attached.
But Dr. Oz, you're saying President Trump has a plan. If he has a plan, why hasn't he put it forward yet? Why don't the American people know about it yet?
The plans that were originally offered during the One Big Beautiful Bill negotiations fell out, which is fine. But when you hold the entire country hostage by shutting the government down, which is what the Democrats have done, you don't allow any discussion. There's not going to be any coordinated effort. You're not going to get one party to compromise with the other party when you're literally holding the entire government hostage. And the folks who would help this system evolve into a mature model aren't at work to help do it. I think we should reopen the government. We should use a clean CR, continuing resolution, to do just that. It needs to be long enough to give everyone time to both evaluate and come up with other ideas. But in the meantime, let people go back to work. Free the federal employees to go help the system do their job.